Siamo all'EULAR per la presentazione dei late breaking abstract e lo studio di cui vogliamo parlarvi è un trial di fase 3 che ha valutato deucravacitinib in pazienti con artrite psoriasica attiva. Ne parliamo con la professoressa Desiree van der Heijden del Dipartimento di Reumatologia Universitaria di Leiden nei Paesi Bassi. Professor Heijden, first of all, which is the key message of this study?
This trial is showing that deucravacitinib 6 milligrams once daily has a good clinical efficacy and is safe in patients treated with psoriatic arthritis, and both the clinical outcomes and also the radiographic outcome.
Which was the design of the study and the type of patient which have been studied?
This was a randomized clinical trial, double-blind, 16 weeks placebo-controlled, and at 16 weeks there's the primary endpoint of ACR20. Patients that were included had active disease, they had at least 3 swollen and 3 tender joints. They all had an elevated CRP above 3, and they needed to have at least 1 erosion on radiographs of hands and feet.
The primary endpoint was the ACR20. Which were the results?
There was a significant difference between the patients treated with deucravacitinib and placebo. There was a delta of 20% in ACR20 response.
You do evaluated also the ACR50 and 70. What happened?
That's true, although they were not in the list of the key secondary endpoints, but also those showed significant difference, but that's then called nominally significant.
There were many other secondary endpoints. Which were the most important and the result of the secondary endpoints?
I think overall we saw good efficacy in patient-reported outcomes, for example, fatigue, the physical function, and there were also data on enthesitis and dactylitis. It was pre-specified that that would be on the 2 trials in pooled analysis. And if you looked at the enthesitis, if you assess it in one index, the Ley index, then there was not significantly different. But if you look at the Spark index, then it was significantly different, and that was also the case for the dactylitis.
You measured also the radiographic progression of the disease.
The radiographic endpoint was a very important endpoint. There was a pre-specified analysis which was very strict on excluding patients if they did not just have the radiograph within a certain time frame, and that meant that 20% of the patients were excluded and the missing data were imputed by statistical analysis. Moreover, an ANCOVA analysis was used, and that's not appropriate analysis, and that analysis was not statistically significant. But if you do the real correct analysis and you include all patients who have at least 2 radiographs and you do a rank ANCOVA, then there's a good separation in radiographic efficacy between deucravacitinib and placebo.
What about safety and tolerability?
It was a very clean study. Only very small percentages, about 2% of the patients had a serious adverse event, and also 2% had an adverse event leading to withdrawal. In all arms, that was the same. There were no deaths.
Summarizing and considering that this drug is an oral drug, which could be the importance of the deucravacitinib in this disease?
Well, I think it's really important. This was the second phase 3 trial in biological DMARD naive patients, but the other one in biological DMARD experienced patients gives similar results. So there is good clinical efficacy, there's good safety, and this trial is also showing inhibition and radiographic progression. So that makes it an all treatment which could be a good treatment for patients with psoriatic arthritis.